the president of the university that I teach at, William V.S. Tubman University, had visions about the responsibility of university when it comes to health issues and crisis. And so when Ebola hit Liberia in March 2014, she approached and charged me to develop a workshop seminar to empower and enlighten the Tubman University faculty, students, and staff about what this disease was, this virus is, and how to prevent it. It was just a simple, you know, one of those of us who teach in the university and college know we get assignment and you do it because you're mandated. It was just simple knowledge, simple seminar. Pulled a group of faculty. We have 6 colleges in the university, one of them the College of Health Sciences, in which I reside in. And so she tasked me to do that. And I give you the little background on that. So we did it was successful. We made it real, and we had our public health and nursing students in a very informal way go out into their community and replicate the knowledge that they received during this workshop. And then we had a wonderful graduation, our first graduation, and we graduated 10 nursing students and 7 public health students, the only baccalaureate public health program in Liberia. And we're hearing the rumors about this disease and the virus, but it's not affecting, because where I work is in rural Liberia in Maryland County, the forest county in Liberia. And so we graduated, and I'm on my way to come home and to go to France for my cousin's wedding. And I just, out of curiosity, because I'm a nurse first and all, and we're always curious about what's going on in our environment. I attended the anniversary of Liberia, which is July 26th. And because my president of the university was the laureate, the speaker of the day, and she presented on servant leadership and what that looks like and why it was needed in Liberia and globally. And the president of the country called a national call where she asked that all the leaders and anyone of interest to attend a meeting on the Ebola situation in Liberia. And since I didn't plan to fly out until August, the wedding was August 13 and this was July 26, I decided to attend the meeting, and I attended 3 meetings. And the last meeting was where the country director of Samaritan Purse pleaded with tears in his eyes of the need for us to take the situation serious and the need for more attention to be paid to the dire situation of Ebola. I will not be talking to you about the virus and the signs and symptoms and the care, the bedside care. I will just be speaking to you from my heart and from what I've learned for the last year. Okay? My objective, I want you to learn, but my objective today is to share the complexity of what it means to fight Ebola in a resource-poor environment, to identify some of the lessons learned from the lived experience of fighting Ebola in Maryland County. Maryland County, one of the counties that we talk about, did not have any original cases of Ebola. Everything was migrated from other counties. And then finally, I hope to have a discussion or dialogue engagement of how nursing and public health professionals, students, and educational institutions can respond to crises of this nature, not just to Ebola. Because I think Ebola is just a symptom of the issues that has been already there in these countries. I wanted to give you all a handout of this very complex schematic. I had the privilege of working with some of the finest men and women during this crisis. One of them was the county or regional director of IRC, which is the International Rescue Committee. This was a gentleman, Dr. Abibi, from Ethiopia, who had worked for years across West Africa, responding to war, a crisis, healthcare-related crisis in times of war. And he, at the time, was in Maryland County and had gone through to the other county where there were cases and they were highly affected, and had done public and professional education about how to protect ourselves. At one of the hospitals that suffered the greatest loss of public health and nursing professionals to this disease, Phoebe Hospital. And he did it before the crisis had exploded. But because you understand, we had a fractured healthcare system, things wasn't operating the way it usually, gloves and isolation materials and hand washing stuff was not the norm, okay? Nobody paid attention. And he used this to tell us how difficult it is to respond to a disease or a virus like Ebola in a country that already was fractured when it comes to its educational system and its healthcare system. And if you look at it, and some of us who are in this room who are public health professionals, this is Public Health 101, right? Right, we talk about coordination of delivery of service, that it takes a lot of pieces. And if you look, my focus, what I did in Liberia was this piece, this area, and this area. And so when I think we're in the midst of the crisis and Madam President Salih got up and begged on TV that, yes, we needed folks, the healthcare workers, the professional, the epidemiologist, and we needed the expert in infection control and all of this, and nurses. She also said, which nobody really paid attention, that we needed social sciences. We needed anthropologists, cultural anthropologists to come in to understand human behavior and how to change it quickly, okay? People who were open to understanding that we were not judging a culture and their behavior. We would not make judgment that those people didn't want to change. They just want to continue what they do. They just wanted to die unnecessarily, okay? So if you look at this, the behavioral and social intervention, you cannot, no matter how good I am at the ETU unit in caring for those patients, we know that in stopping Ebola is preventing it, is identifying the exposure. So we need to know how people behave and how they interact and what the impact of their culture. And so, how we need to look at all of the associations and the traditional people. Everybody has to be a part of the mix. The media is important because the message that is sent about what was happening, is like my PowerPoint has very limited pictures because I believe there was a lot of damage that was done in the beginning with some of the images that came out, people dying and people stealing and robbing and being fearful. It was horrible images that impacted on the ability for us to get the help that we needed. The psychological social support. is enormously needed, even now. Even I as a survivor and what that means, although I've not took direct care of any Ebola patients per se, but having to be in the battle. Right now we're experiencing something where there's this big push to use survivors to provide care. But nobody's thinking, what does that mean? Do I really want to do that? You know, do I really want to have anything to do with Ebola? I told Julie I didn't want to talk about, I really didn't want to do a talk because I'm still trying to recover from what it meant to have spent time fighting this disease from a distance. Logistics, you know, I hear a lot of discussion.
You said they're using the survivors to try to get them to provide care. That means would they have their immunity?
The belief is they're best because they have immunity, okay?
Would not be exposed
and would not be at greater risk. Doesn't mean that they don't provide the same different.
Are they doing research on the people who survive too?
Huh?
Are they doing research on
They have done the research on it. And that's something we can talk about aside the implications for that, okay? Where was I? Logistics. You know, the idea that this was a resource-poor environment or country. And so a lot of the things that we have here, transportation was difficult, the human resource, the knowledge, the wisdom. Liberia went through 14 years of a war, a brain drain, and so it was just getting ready, just rebuilding. Transportation, medications, and supplies. Like I said to you, infection control as we know it, hand washing and glove using as we know it, didn't really exist, okay? It was expensive. Sometimes we didn't have gloves. We didn't have the gown just for basic isolation. So getting that to talk about how did that get there and having to have visuals before we respond, you know, having to see people, having to have, you know, big names dying or being exposed before we respond. That's logistics to me, and I want you to understand that. Epidemiological investigation, surveillance, and lab. There was no lab. We didn't have the expertise to respond quickly. So we needed the global community to do that. Fighting, I threw this in for those of us needed it. Fighting in a resource. What is needed? What is needed? Finance, money. I was talking just before we started this on my way down with my colleague here, you know, about the new health care, affordable health care, and what that means, you know. We needed money. But not only money, when we talk about finance, we needed money in kind, goods, people, because those are finance, and talent. We talk about logistics. The biggest one, however, and my picture kind of blocked that, was technical and administrative support. We needed people who know how to coordinate and could think off their feet. And Liberians are good at that. They're very good at that. But this was a massive crisis, and so we needed this support. But we needed those kind of technical support who would come in, not with the idea that they were coming in helping people who didn't know how to help themselves. And a lot of the resistance and a lot of the issue that began was because of that. I know how best to do this. This is how we are going to do this. And so a lot of the initial resentment and resistance came out of that. And the biggest piece was the need for community involvement. Public Health and Nursing 101. The patient and the community is the center of what we do, right? It's the center of what we do. We can bring all the knowledge and wisdom, but if they're not the center, if we have not gone in and understand what was going on, whatever treatment we give, they'll do, but it will fail, because after we turn our back, they won't be practicing it. And so, for me, as a nurse and a public health person, these are the keys. The next couple of slides will talk about the lessons I've learned. And the key ones, I've sat on some of the folks panel that gathered and discussed on a global issue, on global level, the lessons learned, and they come out of that experience. But for me, sensitization and prevention must be a high priority in fighting disease such as Ebola virus disease. Because in West Africa, we're going to be fighting diseases like this. Because whether we know it or not, this was not a rare disease. It had history and track record and information that every one of us who are teachers in the classroom of health professionals should have been aware of. And I can tell you, I was not. Like many of my colleagues and many of us sitting in this room, and many of the folks in West Africa, they did not know. We did not know about this. We did not know what to do. Community engagement must be taken seriously. And I ask anybody, tell me, what is community engagement? What is community engagement? I'm not testing you. What is community engagement to you?
The community you work with.
Involve, what does that mean?
Plan with them.
Plan with them. Huh? Having them be a part, hearing their voice, hearing their voice, hearing their voice, and taking whatever may seem silly to you seriously. Community must be respected and must be active partners in the decision-making and action-taking. That's some of the things why in Lofa County it went out. We did not respect the burial practices. We did not respect the idea that 99% of the folks' culture depends on relationship and interaction and caring for each other. Okay? So these are lessons learned. Community must lead activities and be empowered in how to respond to diseases of this nature. Even the most illiterate person can learn how to take care of him or herself and can understand if it's done within the context of that person's culture. Okay? This is key. Some of my colleagues, and one of them, Dr. Ron Nesbitt from out of Vanderbilt University, was in Liberia and helped me with that first seminar we presented. And a group of them at the very beginning in April of 2014 drafted a letter saying, let's look at what has already worked in containing this disease. Let's involve the traditional healers. Let's involve the town chiefs. And if you understand the structure of that, there's a lot of traditional, like we have here, the societies that have greater impact in the communities than any of us. The folks who, the community-based organization who used to work, but nobody listened because we were getting some heavy hitters, CDCs, UN, you know, the experts in the field. And I'm not knocking, we needed them. We needed them. We needed them. But again, when I talk of the fact that community engagement is a powerful thing, understanding the cultural and anthropological nature of traditional practice are key to community changing behaviors. You know, this one is something that I didn't even know, that there really is a science in how we change behavior. It's not because I tell you to do it and I give you all the facts and it's very nice facts and it makes sense to me that you should understand it. Don't you understand it? Why are you still, you know, bathing and washing in the water that you bathe the dead with? Why are you still doing that? How archaic. You want to die? And that's initially how we actually engaged, okay? We had nice handouts with beautiful pictures and stuff like that. But we didn't understand. We didn't understand, you know, that change in behavior takes time. And this disease is so powerful that it takes from what, 1 to 21 days before you start seeing symptoms. And if some of us who are into behavior change, it says, you know, using the Alcohol Anonymous Creed, it takes 21 days to change behavior if you keep practicing the same things. Isn't it powerful? I'm always looking for associations, okay? And so that to understand there was a lot more to fighting Ebola than treating people in the ETU. This next one to me, you can't fight Ebola just because you're a health professional, just by being a health professional is fighting it. Nurses and doctors, you know, and all health-related people can't fight Ebola by themselves. It must be involved with a cadre of other discipline. Okay, and I've already talked about the social scientists, the anthropologists, the social worker, the nutritionist, and for me, the veterinarians, okay, the environmentalists who work in the forest. So Liberia had none of those kind. So nobody, or West Africa, Sierra Leone, Guinea, nobody was monitoring what was going on in the forest and seeing dead animals. And you have to understand, many of these countries have what we call food insecurity. So a hunter goes into the forest, or a person goes into the forest and see a sick, dead animal, that's God's gift to me. You understand that? So to have people trained to understand, and then how to synthesize the people the hunters. So we need to understand that. And then for me, coordination, and I bolded, coordination, monitoring, evaluation, activity. The UN and many of the developing countries and many of the NGOs spend thousands and millions of dollars. They pour into all kinds of healthcare programs and activities. But there's not any real monitoring and evaluation of whether they work after you leave, okay? And one of the things, in the beginning in Lofa, you know, they came in and they were sending out people to do community work. Now the average salary, you know, for the average person is $2 a day. And you come in and you get me a job and tell me to go out into my community, you're going to pay me $75. You know, I go. Not that it was deliberately done, not that people didn't care, okay, but the reality of survival. And you go out and you see whoever comes and you sign my paper and you say, well, they've been educated. So taking seriously coordination and activities and evaluation is important. And to dispel the myth that monitoring evaluation is a punitive act. It's not. It's a quality improvement. It's a science. I learned this past July that monitoring evaluation is a science and that there's ways to do it at different levels. And so that may be another major discipline in public health to look at the whole idea of monitoring and evaluation as a specialty. And I believe that university have a real vital role to play in times of crisis. Our university, the entire educational system was shut down. We were due to start August 1st back. It was shut down. So the people who stayed at my university were people who were committed to understanding that we make a difference. And that if we were going to really be a university, we had to stay and teach and educate and provide the technical support that was needed. And so we had students, faculty, staff. And when I talk about that, not necessarily many of our faculty left, because what happened? They went back to where the county they were from to try to help. Many of our faculty from counties that were heavily hit. And so they went back there. But universities are vital during this time. We can't shut our doors and you know, hope it will go away. We have to use all that brain power and that talent that we have. And we don't necessarily have to go there. We have to be able to make connection and networking with our colleagues in the different disciplines in those countries that have these kinds of things. Okay? And Judy, how's my time? Because I want discussion.
Yeah, okay.
Okay?
5 minutes.
Key lessons. I don't know. We have a global health department here, right? I mean, that's the big buzzword, right? Global health, global health, global health. Investment in the science, practice, and leadership development in global health is essential to preventing these diseases. Because of globalization, we can no longer teach in our little environment. Because I know that within 24 hours, I can be in 3 different countries. That means I have the potential to infect 3 continents. And so this is something that we have to take seriously. And I think nurses particularly don't take this, what that means. Our practice is very local sometimes, very national, and we don't understand. Here in the US, in Brooklyn, we are in a global community. I know I worked at LaGuardia Community College for 7 years, and in our college, there was 123 different nations represented. Different culture, different way of teaching them, you know, assumptions made. And I like to leave this piece to ask you, what is your definition of global health? I was in Harvard in July, taking a very intense 3-week course on global health. And it was wonderful. Here I was in the ivory tower of education, and nobody could define what global health is. So a group of us, these are students, 40 students from across the world, right? And we decided, we got together because we have alumni, that we were going to go and individually, at any any interaction we have, ask, what is your definition of global health? You don't have to answer, but think about it. What is your definition? I know this gentleman gave me his, and he used 2 buzzwords. Can you remember? Can you say it?
The enterprise of improving the well-being of people around the world.
Right. 2 things he said, enterprise and people. It's not about nation, right? It's not about organization, people. And I think that's one of the reasons, the lessons learned, the importance that Ebola is not a West African problem. Ebola is not Liberia's problem. It's a global health problem. And it comes, for me, it comes out of the unappreciation of the fact that health care and good health care should be a right, not a privilege. And that we here in this country, we argue about who should have and what should have and which should be there. And that much of the problem in health care is that we focus on disease and illness, because that's big money. And I learned that from Harvard. Big money. Can we provide drugs to treat polio and HIV and malaria without cost? It's big money, right? And that education is and must be a master weapon against global health inequality. And conversation is needed. Conversation, talk, chatter. A lot of that went on at the beginning, right? You all lived the experience, and it was like watching a surreal movie. You could go on YouTube and get all of the video of, you know, the victims, right? But must stop quickly, and action taken quickly, and that action must be ongoing. Right before I came back to the States, we were declared in Liberia Ebola free. And right after that, within 15 days, the big monies for supporting some of the NGOs that were sitting on the ground, Partners in Health, which is one of the ones that we work with because they believe in long-term and sustainable activity. The money's $7 million was pulled. That money was going towards incentivizing people who were working on the front line of education, of treating victims and survivors. And so what happens? We had what? We had a case. We had a case. And people said, oh, it's because the people didn't, just forget and they complain and they lazy and all that kind of stuff. No, remember I said it takes money? It takes money. Healthcare is expensive. Preventing a disaster like this is expensive. And yes, there's corruption. And yes, monies was done other things. But the bottom line, there were people in Liberia, Liberians, who did the right thing with the funds and the resource and tried to be accountable. Well, you can't, again, change behavior overnight. But action taken and some of the things we put in place must stay in place. And Ebola and Ebola-like disasters must be not an immediate event. It must be ongoing activity and be in the conscious mind of all of us. And I think those of you in this room who are from public school, the School of Public Health and the College of Nursing, that is your responsibility. And the young people who are entering this profession, that is your responsibility, okay? That is your responsibility. So, I'm ending. Tell me my time.
Okay, you're done.
These are my personal ones. These are the ones that are important to me. The resilience of human beings is awesome. This is the country that has faced war, complete destruction. I cannot tell you. When I went there in 2010, the gentleman that was my vice president of administration told me that I was going to be living in a hotel-style living. So I'm figuring, but I'll be sharing a bathroom. So I'm figuring hotel-style living, towels, stuff like all the stuff that I had brought with me was not necessary. Well, it was hotel-style living. It was one of the worst hotel that I've ever stayed at. You had to walk up 5 flights. You had to flush with water to flush the toilet. It was horrible, all right? But I had good colleagues, okay, that kept me focused. And that the resilience is important. Respect that, okay, respect that. Loving your neighbor as you love yourself must be practiced in the small things we do. Sometimes we talk our faith here. We one of the public Christian nation, I think we are, right? But we don't practice this, okay? And so we waited for pictures to be shown before and people to die before we would respond and for the scientists to say this real, okay? Sorry, folks. Maintenance of human dignity must be woven in the fabric of our action in times of crisis. The burial practices and some of the practices are not to be poo-pooed on, are not to be disrespected, but to be understood. And it wasn't because the people didn't want to understand. It was because they weren't informed in a cultural sensitive manner of the implication. And the people who needed to be at the table to do that information, such as the imams and the leaders, the traditional, were not originally invited. You understand me? So human dignity. Relationships matter, and prayer does work. There were groups of women who sat out in the sun for days, for months, praying for Ebola to break. And I know personally, if I didn't believe prayer worked, I believed, because I knew that was a, and one, you know, I am a lionist, okay? And so Ellen Keller says, alone we can do so much, but together we can do so much more. We've got to stop it and talk about what that means, and that we can't just educate, we have to be involved. Again, this is what I think universities and colleges, particularly those of what we call the caring profession, public health and nursing. And so this is why I stayed in Liberia. These traditional midwives who we pulled in to talk and to educate about Ebola and how important Ebola, their work in stemming Ebola would be if they would become active ambassador of education on Ebola, okay? So this is the reason I stayed, and for my action. This is the reason for my action. These are community-based organizations, leaders, and we are writing a proposal to help them gain funds from UNICEF to do community engagement activities. They have been staunch leaders in their community working. They know the people, but they do not have the technical skills and wayward to do a good proposal so UNICEF, an agency like UNICEF, would fund them. These are the 10 nursing students that graduated 2014. They just recently, in June 2015, passed their boards, and we call them the change agent for healthcare in Liberia in the Southeast.
All men.
Okay. No, they're all men, one female. And that is a cultural issue that we deal with, right? And we begin the next class has more female than males, and you can understand who influenced that, right? Okay? But this is good. All of these, 90% of them are what we call native Liberians, and first generation students, compassionate. We started out with 17 nursing students and 10 graduated. I have great hopes. And again, I want to thank Bedford-Stuyvesant Family Health Center, Jean Black, Judy, a lot of other of my colleagues who helped support these students through the 4 years they were going through. Go, Judy. My reasons. This is the next generation of female leaders. This is our yearly Women's History Month, where we go out and mentor the young ladies in the high schools and junior high school to stay in schools, to stay focused. Many more than half of these young ladies already have their first child, and they're in the 11th and 12th grade. And so we mentor them, new crop every year, and then we continue that mentorship through the next year of Women's Month. Go ahead, Judy. My ending quote, and it's not mine, okay? As a human being, I acknowledge that my well-being depends on others, and caring for others' well-being is a moral responsibility I take seriously. It is unrealistic to think that the future of humanity can be achieved on the basis of prayer or good wishes alone. What we need is to take action. Therefore, my first commitment is to contribute to human happiness as best as I can, and that's the Lama. Okay? I thank you for the opportunity to present. Much blessings. I open this discussion for your questions. You asked a question? You asked a question. Right?
If there's going to be reinfection,
Right. One of the research, many of the we knew this long before, was the fact that Ebola survivors, for whatever reason, have will develop an immunity to that particular strain of Ebola virus, because the Ebola virus has different strain. And what happened was this most severe strain, the Zaire virus, that attacked us. And so the thought was that because of that, they would make ideal healthcare workers to provide direct patient care. And it's good, and some of them have volunteered. But the outcome of that is that, as we learned with the research, is that the psychological, emotional trauma that they've gone through, they need time to heal. And so some of them don't want to have anything to do with this. Does not mean that they don't care. We also have learned that, and just for information, that the virus, although in the blood, in males, it's cleared, but we know in the semen, it usually still lingers for 90 days. So again, that's a whole new avenue, and we don't know enough about that even. So that's some of the constraints. I don't know if that answered your question. There's a lot. I didn't provide any technical stuff like that, which I could, because I really wanted you guys to really go in depth and do the research. There's a lot of information there, and I can provide a bibliography for Judy to share with you on, the lessons learned from a very, cerebral point of view, and also the research. There's research that looks at pregnant women and whether or not they can mask symptoms be longer before they're manifested. So there's a lot, and I think there's a wealth of grounds for research, psychosocial, and that's why I shared that particular slide, because I think there's areas within there that nurses and public health folks could do some research outside of the patient care and community care activity that can contribute to the body of knowledge.
What would you say was the greatest insight you had when it came to the anthropological methods to change behavior quickly?
That enough education is not enough. Education is an engaging and understanding behavior and stepping out of my comfort zone and my belief. For me, that's important. How do we do that with our students? To have them live that experience. It's like I have a thing I do with students. To experience what it means to be blind, I have them wear dark glasses and put on, I don't know if we use that, and put on Vaseline and sit in a wheelchair for 24 hours, and they have to go through the subway and all those kinds of things like that. You see what I'm saying? Yeah. Oh, yeah. So I said, for me, the lessons learned that we need to expose ourselves to understanding culture from a different perspective, not just from what we learn in the books. Margaret Mead is one of my favorite anthropologists, because she said you have to live in there and be part, but not to be able to observe. My friend.
Thank you very much for bringing us back to some of the basics that people get away from, and for your experience. So, were there community leaders that, first of all, I just want to say that one of the statements that you were talking about, getting involved or making sure that people in the community are involved, one of the ways I tell students is nothing about us without us. And that's one of the ways that people don't get engaged if you're trying to do it and you're just doing what your agenda is. You don't have any idea of what else is going on.
Right.
So my question is, were there thought leaders or community leaders who were engaged? For example, you didn't say Charmin, but was there somebody like the Charmin or anybody that the outside community related to, the NGOs related to?
Yeah, I mean, specific name, but yes. Once we got it, once we understand what how to attack this disease, traditional leaders, and let me tell you, in the county I was, it was rural. The only way we could have battled this and prevent infection entering this county was the work of the youth leaders, the traditional leaders, okay, the imams, the traditional healers, a quadrant of folks. We could not have done it without them. And to have leadership, I think in Maryland County we had leadership at the time in our acting superintendent, who, you know, despite all things, realized everybody needed to be at the table. And so we had weekly meetings where every fragment of the society was at the table, and the voices were listened to, and opinions were heard, and then to kind of focus us. That's why we were able to have a very compassionate, very dignified border surveillance, so that we would be able to survey people coming into the county, but doing it with dignity and with follow-up. Okay? Yeah. Thank you. Judy?
Thank you, thank you, thank you.
Thank you.
Yes, you have taught us a great deal and reminded us a great deal.
Okay. It's my pleasure.